In this video, we'll be discussing the drugs for bronchial asthma. Now, these drugs can be easily remembered by looking into the pathophysiology of asthma. So, the pathophysiology of asthma, we have a trigger factor which can be cold, dust, etc. And these trigger factors, it induces airway inflammation. Now, as a result of airway inflammation, there is bronchoconstriction, which leads to the clinical features of asthma such as wheeze and dyspnea. Now, to treat asthma, what we do is we can either decrease the airway inflammation or we can reverse the bronchoconstriction. Now, drugs that decrease or inhibit airway inflammation are the leukotriene antagonists, the mast cell stabilizers, the anti-IgE antibodies, and the corticosteroids. So these are the drugs that decrease airway inflammation, and we have certain drugs that cause bronchodilation. So let us look into the classification for bronchial asthma. So remember the 5 classes of drugs. We have 4 classes which decrease inflammation and 1 class of drug which causes bronchodilators. Now let us look into the bronchodilators first. Now we have 3 classes of bronchodilators. The first are the beta 2 sympathomimetics, and the important examples are salbutamol and terbutaline. Next we have methylxanthines. Now remember, these drugs, they end with the term phylline, so we have theophylline and aminophylline. The next is anticholinergics, and the examples of which are ipratropium bromide and tiotropium bromide. So remember, bronchodilators, we have 3 classes: beta 2 sympathomimetics like salbutamol and terbutaline, methylxanthines, which ends with the term phylline, so we have theophylline and aminophylline, and finally anticholinergics called ipratropium bromide and tiotropium bromide. So these are the bronchodilators. Next we have 4 classes of drugs. The first 4 classes of drugs that decrease airway inflammation. The first of which is leukotriene antagonists. Now the examples of these are montelukast and zafirlukast. Now you can see the term lukast. So luke for leukotrienes and ast, which is a short form for antagonists. So leukotriene antagonists, the examples are montelukast and zafirlukast. Next we have mast cell stabilizers. The important example is ketotifen. So mast cell stabilizers, ketotifen, and the other example is sodium chromoglycate. Next we have corticosteroids. Now we have systemic corticosteroids and inhalational corticosteroids. The systemic corticosteroids are prednisolone and hydrocortisone, and the inhalational corticosteroids are beclomethasone dipropionate, and fluticasone propionate. And finally we have the anti-IgE antibody, which is known as omalizumab. So again, the drugs that decrease airway inflammation, we have number 1 the leukotriene antagonist, which ends with the term lukast. So we have montelukast and zafirlukast. Next we have mast cell stabilizers. The most important example in this is the ketotifen. Then we have systemic and inhalational corticosteroids. The examples of the systemic corticosteroids are prednisolone and hydrocortisone, and that of inhalational corticosteroids are beclomethasone dipropionate and fluticasone propionate. And finally we have anti-IgE antibody called omalizumab. So these are the drugs for bronchial asthma. Remember the 5 classes, 4 of which decrease airway obstruction, and the last which reverses bronchoconstriction, that is bronchodilators.